Back to West Michigan's dry weather. The heat is taking its toll on crops, your lawn, and your pocketbook. But have you thought about how it can affect your health? It's affecting a lot of people out there. Dr. Jennifer Cory of Metro Health joins us live right now with more on how you can stay healthy in all of this heat. Dr. Cory, thank you for joining us tonight. We appreciate it.
Thank you for having me.
Let's talk a little bit about this. What kind of illness do you think heat can cause you? We know about heat stroke and dehydration, of course, but what are some of the other medical conditions that people can really be suffering from right now?
Well, certainly heat exhaustion and heat stroke in addition to dehydration, but these things can add to chronic medical conditions that people are already suffering from. Asthma, allergies, heart conditions, lung conditions such as COPD.
So what is it that someone can do, for instance, allergies right now? How can some people that are, you'd think actually that allergies wouldn't be as bad in the heat because there isn't a lot of moisture and a lot of things flying around in the air. What are your thoughts on that?
That is definitely true in some cases. Because it is so dry, there is not as much mold and growth of spores like that. But the pollen counts are still very high. And when it's this dry, there's a lot of dust, and that can definitely affect allergies. One of the most important things is just avoidance, staying inside. Another thing is using saline nasal rinses, saline gels to moisturize the inside of the nose to help your body naturally protect itself.
Sure. So it depends on what you're allergic to then, because there's plenty out there that can cause some problems.
Exactly.
Yeah. What about heart conditions? How can the heat really hurt somebody in that way?
Well, the main thing is dehydration. I actually saw a patient in my office today who was suffering from that, and his heart condition was adversely affected. So for him, it was really just trying to get him hydrated, and it's so challenging in these conditions to do that.
What are some of the warning signs that people need to keep in mind, other than something that's just uncomfortable? When is it starting to get serious?
I'm sorry, I couldn't hear you on that last question.
Just wondering, what are some of the symptoms that people should pay attention to that things are starting to get serious? So they're not just uncomfortable now, but this is a problem. They need to either seek medical attention or take some changes, make some changes quickly.
Well, the most important thing is if you stop sweating or stop urinating, that's a huge sign that you're extremely dehydrated and actually important to get to the emergency department.
Okay, of course, stay hydrated during this extreme heat. Dr. Cory, thank you for joining us tonight. We really appreciate it.
Absolutely, thank you.